Hello, my name is Clark and I'm a soldier in the Royal Electrical and Mechanical Engineers. It's my job to fix helicopters.
And my name's Tom, I'm a medic in the British Army.
Today we're going to be helping you to get your emergency aid badge. So Tom, why do we need to get help?
You need to get help as soon as possible, as it may save someone's life if they're seriously unwell or injured.
And what would you do to get that help?
So, to get help, you need to dial 999, make sure you're safe to do so, and ask for which service you need.
And what would you say while you're on the phone?
So when you're on the phone, you need to tell them where you are, the patient's name, their injuries, their age, if they're male or female.
And then what would you do?
So you need to stay on the line, follow any instructions that they give you. If you have help with you, get someone to go and wait for the ambulance.
My name's Chloe and I'm a medic in the British Army.
Hi, my name's Vicky and I'm also a medic in the British Army.
Today we're going to be going through how to help someone if they're bleeding. What would you do if you came across someone with a bleed?
If I came across anyone with a bleed, I will try and stop that bleed as soon as possible. The best way to do this is to use items like bandages, scarves like you wear around your neck, tea towels if you're in the house. We'll put that around the wound where it's bleeding tightly and make sure it's secure. Another good thing is to maybe raise the limb if it's an arm. I'll put pressure and I'll raise the limb and this helps stop the bleed.
An example of a bandage you'll find in a first aid kit is this, which you just wrap around the wound and keep going until you've used it all, so it's tight and doesn't bleed through. It's important to remember to call 999 if the bleed is too heavy and you can't stop it yourself. What would you do if the bleed goes through the bandage?
If the bleed continues, then I'll apply another bandage on top of it to try and stop the bleed.
To recap what we've just been through, call 999 as soon as possible if it's a heavy bleed, keep pressure on the wound, raise the limb if possible, and stay with the patient until help arrives.
Hello, my name is Clark and I'm a soldier in the Royal Electrical and Mechanical Engineers. It's my job to fix helicopters. But today we're going to be talking about what to do if you find someone unconscious. The first step in finding someone unconscious is to check that they're breathing and got no life-threatening injuries, but today that's already been done for us. So the first step of finding someone unconscious would be to kneel down next to the patient. You would then grab the arm closest to you, stretching it out to a 90-degree position, and then grab the other arm, putting the back of the hand against their face. You'd then grab the leg furthest away from you and raise it to a 90-degree position and gently pull the patient towards yourself. This is until they reach the side. You'd then tilt up the head to make sure that they can still breathe. This position stops the patient from choking and allows help to arrive. You would then go and call 999, and throughout this procedure you would be reassuring the patient, telling them what you're doing. But for this video we've not done that so that you can hear me.
My name's Chloe and I'm a medic in the British Army. Today we're going to be going through the final stage in your emergency aid badge, which is reassuring someone in an emergency. The first step in reassuring someone is being able to talk to them. They might be worried, anxious or confused. You must talk in a quiet and confident manner as to not worry them anymore. This is how you should reassure someone in an emergency.
You alright there, mate?
Oh, mate.
What's your name?
Oh, Tom.
Tom. What have you done?
Oh, I've hurt my ankle.
Oh, how have you done that?
I tripped over.
Okay. Well, we're going to get your help anyway. Alright?
Okay, thank you.
The person who was reassuring the casualty spoke quietly and confidently as to not worry him anymore. He asked him his name, what had happened, and promised him he'd get help soon, which is exactly what you should be saying to make sure they're not any more worried than they need to be.